Hello. My name is Glenn Parker, and I want to thank you for joining us today for a conversation about prostate cancer in the time of the coronavirus. Now, I'm a volunteer with the American Cancer Society, a prostate cancer survivor, and one of the founders of Run for Dad, an event that includes a 5K run, a 2-mile walk, and is designed to raise awareness about the dangers of prostate cancer in men. I don't know if you knew this, but 1 in 9 men will get prostate cancer in his lifetime. That's astounding. Just think about that number, 1 in 9. And prostate cancer is the second leading cause of cancer deaths in men. Now, the COVID-19 pandemic has taken the medical focus away from many other serious diseases, including cancer. While health systems have been diverted to fight the coronavirus, people have been forced to, or out of fear or an abundance of caution, have elected to delay important cancer screenings. But cancer cannot be put on hold. The Cancer Society estimates that almost 200,000 men will be diagnosed with prostate cancer this year. That's still an astounding number, although it has come down. This is why Run for Dad will continue this year, although as a virtual event. In other words, you can run or walk anywhere you like, on the city streets, in your neighborhood, in a park, even on a treadmill, on your couch. No, you can't do it on your couch, actually. As long as it's safe and you can, of course, maintain social distance. Now, another important way that we accomplish our mission is through education and connecting you with experts who can provide important prostate health information. And to that end, today I'm joined by Dr. Jonathan Lebowitz, a board-certified diagnostic radiologist at Princeton Radiology. Dr. Lebowitz did his radiology training at NYU Medical Center and continued on to do fellowship training in MRI. In addition to being a clinical radiologist, Dr. Lebowitz is also president and managing partner of Princeton Radiology. Providing services at 5 imaging centers and 2 hospitals, Princeton Radiology is committed to bringing empathy, compassion, and remarkable imaging experience to the communities they serve. Thank you for being with us here today, Dr. Lebowitz.
Thank you for having me.
So let's begin. Let's jump right in here let me ask you, who gets prostate cancer and what are the risk factors associated with this disease?
Well, all men are at risk of developing prostate cancer. As you said, it's unfortunately one of the more common cancers in men. But that risk significantly increases as men get older. The average age of a man diagnosed with prostate cancer is about 66 years old. Unfortunately, African American men are at higher risk of developing prostate cancer and of dying of the disease. And men whose father, brother, or son have had prostate cancer are twice as likely to develop the disease. Also, men who have inherited mutations like what sometimes is called BRCA gene positive are at higher risk for developing a prostate tumor.
Well, how do you screen for prostate cancer? And who should be screened?
Well, this is something that's been controversial in the past. The goal of screening for prostate cancer is to find cancers that may be at high risk for spreading if not treated, and to find them before they spread. Finding prostate cancer when it's still at an early stage offers the best hope for living cancer-free for a long time. Nearly 100% of men diagnosed with prostate cancer in its early stages are still alive 5 years after diagnosis, which is why it's so important to try to detect the disease early. Unfortunately, there are no universal guidelines, and men should all discuss prostate cancer screening as well as their own risk factors with their doctor to determine at what age to begin regular screenings and at what frequency. But I can tell you the most common screening method is what's called a PSA test, and PSA stands for prostate-specific antigen, and I'll talk about that in a second. Most men also undergo what's called a digital rectal exam by their referring physician, and this may also be done as a routine part of screening, especially in older men. The PSA test is a substance made by the prostate-specific antigen is a substance that's actually made by the prostate gland, and the levels of PSA in the blood may be higher in men who have prostate cancer. If your level is high, you might need further tests to look for prostate cancer. For example, men with PSA between 4 and 10, often referred to as borderline, have about a 1 in 4 chance of having prostate cancer. And if the PSA is over 10, the chance of having prostate cancer is about 50%. But there are other reasons for having elevated PSA levels. For example, the benign enlargement of the prostate gland called benign prostatic hypertrophy in and of itself sometimes can give elevated PSA levels. So it's important that you speak with your doctor about screening in general and then discuss the results and what it might mean. I do know that local urologists in our area are recommending screening with PSA and a prostate exam beginning at about age 50 until about age 70, although they may extend beyond 70 for men who have greater than a 10-year life expectancy up to about age 80. This is in asymptomatic patients, as sometimes they'll do PSA for evaluation in patients who have symptoms. There's also another test that men may hear about that's a newer test, and it's used less frequently, called the 4K score test. That's the number 4, the letter K, score test. It's not typically used as a screening test, as the test won't be run unless the PSA is greater than 3. But a doctor or most more commonly a urologist may reserve a 4K score test for somebody who's previously had an abnormal PSA level or after a negative biopsy, but the PSA is still rising. Although some urologists might do it earlier if the patient really wants one done. Unfortunately, it's one of these tests that insurance companies don't pay for, but can be a good adjunct test for doctors to do. Clearly, no definitive guidelines exist and somewhat subjective. In the past, there have been some conflicting guidelines in different medical societies, but that's a reasonable summary of best practices to date.
Yeah, but I think the point you're making is that if prostate cancer can be detected early, your chances of survival are very high. What about a prostate MRI? How does that fit in?
Right. So prostate MRI has been around for many, many years. When I started my training in the late 90s, it was just coming into practice as a test. And when we started doing it, it was really to look for patients who already had prostate cancer, and we were looking to see if the prostate cancer extended outside of the gland, to so-called stage the disease and see how advanced it was. That was 25 years ago. Now it's become a much more accurate, a state-of-the-art tool that offers an alternative, analytical, and sometimes interventional invasive screening option that can potentially spare some unnecessary biopsies. And if it can do that in the proper setting, it's a very useful tool that can spare the complications perhaps of a biopsy, such as hematuria, rectal discomfort, even sometimes infections. Prostate MRI can also show if the cancer has spread outside the prostate gland into the seminal vesicles or other nearby structures, and it can be important in determining treatment options. The prostate MRIs that we do here at Princeton Radiology are state-of-the-art. They generally involve high-resolution detailed pictures produced by a very strong MRI machine, but where the bore of the machine is wide open, so the men are generally very, very comfortable laying inside the machine. And then we use computerized modeling to detect the amount of blood flow to the gland itself, and that also helps us look for small areas of tumor. All of this can result in three-dimensional maps, including color maps, that helps us look at the gland in great detail. And now we're peering into the gland itself, not just looking at disease outside of the gland. We're peering into the gland itself and looking at areas of abnormality, and it can be used as a screening tool. I think one of the issues, and it's something that doctors run into all the time now, is except with Medicare patients, in practicality, MRIs are less performed now unless at least one negative biopsy is done with a rising PSA level, as most insurance companies don't really approve an MRI as a screening tool. This is a real shame and something medical insurance companies need to look at further to better the health of their patients. The irony being that many insurance companies actually want you to have a biopsy before you have a non-invasive MRI. It doesn't make sense to me, but unfortunately insurers have not yet seen the light with respect to the excellent assessment that MRI provides. For Medicare patients, because there's no pre-approval process, a urologist may do a preemptive MRI if the PSA is elevated, or there's some other suspicion and they're debating whether or not to do a biopsy. It's a shame and probably not best for the patient for commercial insurance companies to deny payment for a prostate MRI when it's such a useful tool to detect prostate cancer and target any abnormal areas for biopsy. Rather than having the patient go through an invasive procedure first, the MRI could be performed to let the urologist target precisely the areas of abnormality within the gland. And this is new technology for urologists as well, where they're fusing the MRI pictures with ultrasound in their offices to precisely pinpoint where the biopsy should be obtained. If there is a patient that does have commercial insurance and there is difficulty with that insurance company approving the MRI, Princeton Radiology does offer prompt payment rates if the patient would like to obtain an MRI anyway, and I would encourage them to just call us and discuss this option.
If someone needs to come in for an ultrasound or an MRI or some other exam during this particular time, can you tell us what steps Princeton Radiology is taking to protect patients?
Absolutely. So we have followed CDC, OSHA, and New Jersey Department of Health guidelines throughout this pandemic, and we have the safety of our employees and our patients and our physicians and anybody who comes through our facility as paramount in our minds. So at this point, and it may not change for a bit because this pandemic continues, it is safe to come to Princeton Radiology. We have had from the very beginning screening questions and screening procedures that will assure us and the rest of our patients that no one with COVID related symptoms or a suspicion of COVID comes through our doors to get imaging. Those patients may be reserved for hospital settings. In addition, at every one of our office's front doors, we screen every person who comes through our office, including the doctors like me and the patients who work and the employees who work there, and all the patients. They get temperature screened when they come through the door, as well as screened for patients get screened for travel history and other symptoms and risk factors. In addition, all of our employees are wearing PPE, and we're practicing social distancing and ramping up our cleaning procedures appropriately within the office.
That's great. So thank you for going through all those measures. Those are extremely important.
Sure.
Are there any other special hours for cancer patients?
We do have some. There should be on our website. We are, I believe, having special hours for seniors and for those with immunocompromised systems. Okay. So you can look for those on our website or call our office, and we can accommodate you.
Great, that's good. So thank you very much for this. And any closing thoughts or any resources you want to direct us to that would be helpful for those of us out here in the audience?
I think the American Cancer Society is a great resource. Obviously, we have some materials on our website. And, I think your local physician network here in this area is excellent. I would suggest that everybody reach out to local physicians, local hospitals. All have resources that are able to help and answer questions.
Okay, great. Thank you, doctor. That was most informative and helpful. And finally, let me encourage everyone in the audience to join in and to support Run for Dad this year, the virtual Run for Dad. For more information and to register or start a team or donate to a person or to a team, please go to our website, which is www.runfordadnj.net. That's runfordadnj.net. Remember, you can walk or run anywhere that's convenient and safe for you. And keep in mind the importance of screening and early detection. It can save your life.